Adams. We turn now to our health spotlight tonight and welcome in WISH TV medical expert and former Surgeon General Dr. Jerome Adams. Several things have popped up since the last time we talked, sir. Pfizer has submitted its data, as you know, saying 3 COVID vaccine shots can protect children up to the age of 5. So any surprises for you in that data, Doc? And what should parents take from it?
Well, it's important for parents to understand that during the massive wave of Omicron infection during the past winter, children younger than 5 were hospitalized at a rate 5 times the pandemic peak. That's the context for this discussion that we're having. And Pfizer's vaccine was shown for children 6 months to 5 years of age to be 80% effective at preventing illness during the Omicron wave, according to preliminary data that was released yesterday. What's important is they previously looked at 2 doses of vaccine, and it was only about 40% effective. That third dose kicked it up to 80% effective, and it's based on a trial of over 1,500 children under the age of 5 who received a third shot at least 2 months after the second dose, when Omicron was the main variant in circulation. So that's another key. This is during the time of the Omicron wave.
Lots of talk about monkeypox this week and a handful of cases under suspicion right here in the United States. Just how concerned should we be about this? And is this a big deal, Dr. Adams?
Well, it's a big deal for us to pay attention to, but at this time, we don't need people to worry. The numbers are still small. We want folks to be aware of the symptoms and reach out to their doctor if they have symptoms. These symptoms are typically flu-like: fever, chills, headache, muscle weakness, followed by a swelling in the lymph nodes, the area in your neck, under your chin. And that's what distinguishes it from smallpox. Why do I talk about smallpox? Because monkeypox is a much less severe cousin of smallpox, and it's spreading around the world. It's typically been confined to Africa, but we now have more than 250 cases reported in 16 countries, according to the World Health Organization. It's spread by close and prolonged contact with an infected individual. So it's not as contagious as smallpox, not as contagious as COVID. Again, not a reason to worry at this point, but it's definitely something that should be on our radars. And remember, if you wash your hands, if you're cautious, if you cover your mouth when you cough, if you stay home when you're sick and stay away from other sick people, that's going to help you avoid monkeypox and a whole lot of other diseases out there, too.
Yeah, so some relief on that tonight. All right. So one other question before we let you go, Dr. Adams, and I appreciate you taking some time as always. We saw the new Surgeon General report this week warning about burnout among healthcare workers in the United States after the pandemic. Are we at a crisis level in healthcare?
Well, we're absolutely at a crisis level in healthcare. We have over 500,000 registered nurses anticipated to retire by the end of 2022. The U.S. Bureau of Labor Statistics projects we're going to need 1.1 million new registered nurses within the next 5 years, and that we're also going to have a shortage, according to the American Association of Medical Colleges, of up to 140,000 physicians, which is why Surgeon General Murphy put out this advisory saying that burnout had reached crisis levels. And speaking of burnout, I do just want to say my heart really does go out to the victims of that shooting. Mm-hmm. We know that people are burnt out across the board, not just clinicians. Kids are burnt out, teachers are burnt out. Thoughts and prayers are good, they're important, but we've got to do more than that. We really got to get serious about paying attention to mental health of everyone across the board and paying attention to safer firearm ownership if we're going to create a better world for our kids. This really hits me hard as a parent of 3 school-age kids. It's unacceptable, and we've got to do more than thoughts and prayers this time around.
Mental health, Dr. Adams, such an important topic, as you just mentioned. Do you think it's been overlooked over the past couple of years?
It's absolutely been overlooked. And again, what we have is a mental health crisis in this country that started before COVID. It was made worse due to the isolation of the pandemic, the fear of the pandemic, Ukraine, where, you got our kids hearing about the possibility of World War III. There's a lot of things going on in society right now, and we haven't paid enough attention to our overall mental health in the past. Mental health and wellness, in addition to recognizing mental illness, 2 different ends of the spectrum. And you see it manifest in substance misuse. You see it manifest in people acting out, as has happened with several shootings. And again, we've got to reconnect the head with the rest of the body and look at mental health the same way we look at physical health.
Yeah, couldn't agree with you more. Dr. Adams, always good to see you. Thank you for joining us here on a trying day across our country. Thank you.
Thank you, Phil.